Hello class, today I'm going to be demonstrating the basic airway and advanced airway adjuncts. So this includes nasal cannula, bag valve mask, nasopharyngeal airway, oropharyngeal airway, laryngeal mask airway, endotracheal intubation, Yankauer suction, and bougie. So first we're going to talk about some basics, and the most basic includes your nasal cannula, and you'll identify the actual nasal cannula, you'll hook it up to oxygen, which your tree will be up in the back, and you'll want to place it over their ears and into their nose. It'll be at the front of their body, like so. And then just tighten it up right underneath their neck. Okay. So that's your nasal cannula placement. Non-rebreather mask is also identified right here, which you'll just put around their face like so, and then up to oxygen. And the reservoir will fill with oxygen. Bag valve mask, which is indicated for folks that are unconscious with possible cardiac arrest. So we have our actual cover right here, and there is the actual capnometer, which can be identified right here. So you want to do a C3 technique. Place the sharp part over the nose, 2 fingers over that, and then 3 fingers over the mandible, and you should see bilateral airway. Bilateral chest compression right there. Okay, and there should be changing color in the capnometer. Next, nasopharyngeal airway, which you measure from nose to earlobe. Okay, so I have it measured out with my hand, and we're picking out right here would be good. So you want to have it facing upwards into the nares, turn around, and through like that. Okay, that's your nasopharyngeal airway. Oropharyngeal airway can be maintained only in an unconscious patient where their gag reflex will not be intact. So you want to find that by the corner of their mouth to the angle of their jaw. Okay, so I'm measuring that out with the OPA right here. So have it tilted up, turn it around, right there in the mouth like that. That's your OPA. Moving on to more advanced airways, LMA, which really is something that you might want to consider after a failed endotracheal intubation attempt, which would be more definitive. You want to remove, you don't want to do that. You don't want to drop anything, but you want to use the syringe to take all the air out of the device, like so. So it's nice and flat. In a sniffing position, neck flexion, nose up, you'll place the LMA just directly all the way back past the tongue. Once it has been properly placed, now you're going to inflate the LMA, and then you can attach the bag valve mask. And this will establish somewhat of an airway, but it's not as effective. You can see some of the lung moving in this case. So take it out, use the syringe, open that up. Going more advanced, we have endotracheal intubation. You'll want to identify the proper size. 8.0 is for a typical adult, and you want to identify, MAC blade is typically utilized, so we have this all ready to go. So here's your handle, and your blade will come in, click in. You have your light right here. Using your non-dominant hand, you want to sweep the tongue, okay, and have the neck flexed, sniffing position. Sweep the tongue, and you probably want to check to see if the bulb inflates of the actual tube. right, so it is working. So you want to remove the air in that case. Okay, your stylet ready to go. So swipe the tongue, move it laterally, and you want to see the vocal cords. Okay, so 45 degrees up and out, and then you're going to want to place the tube right under that glass and it's where the vocal cords are. Typical spot about 20 centimeters right at the lip. Okay. Remove the stylets. Add air into the syringe. And now use the bag valve mask into it. And you see bilateral expansion of the lungs. Obviously you wouldn't see an actual chest cavity, so you want to listen to both lungs, making sure that you hear sounds in both the right and left lung, and then also check the stomach to make sure that you didn't accidentally get into the esophagus. Capnometer is in place. You want to tape this down. You can take tape and place it over the nose and drape it around. It is your job to make sure that you do get a chest x-ray to identify that is in the right location. And then you'll need to maintain analgesia and anesthesia while someone is intubated. Someone should not be intubated while awake. Okay. Another advanced technique is using a bougie, and I'm going to remove this ET tube. So the bougie is a very long, rigid stick basically, and it has a curved tip at the end. And you will use your actual blade, and like a typical endotracheal intubation, you want to identify the vocal cords. The biggest benefit is that it's smaller and it might be easier to fit in. The other thing is you might be able to also feel the tracheal rings on this. All right, so same placement, and sometimes you have to do this blind if things are really messy. So stick it right in. You might feel the tracheal rings on this. Now you want to take the ET tube that we had on here before, and then you place it directly over the bougie. So you slide it, following the bougie into the vocal cords as a guide wire. Your goal is about 20 centimeters at the mouth. You go up to 24 based on the person. Remove the bougie, and then now you're going to want to place the bag valve mask for confirmation. A lot of people, when they have an airway emergency or they require intubation, they might have foodstuffs or vomit in their mouth, and you want to clear that so you can visualize everything. So you just attach it. It's a rigid tube and a nasal gastric decompressor, and that can clean everything out. And that is your basic and advanced airway techniques.